Good evening, everyone. Welcome to our legislative advocacy webinar update featuring Matt Delaney from the National Bleeding Disorder Foundation. We are so excited that you're joining us this evening or watching the webinar as a recording. This was a presentation that Matt gave at Fall Fest, and based upon recommendations and comments, we are really excited to offer this presentation to those that could not attend Fall Fest. There is a lot happening when you hear the word legislative advocacy, health insurance, and it's a really important topic for us to really understand as a community. So, with that said, I'm going to introduce Matt Delaney, who is a dear friend of Neha and myself, and has a wealth of knowledge. So you're in for a really exciting ride over the next hour. So Matt, I'm going to turn it over to you.
Awesome. Thanks so much, Rich. And totally likewise. Hello, everyone. Like Rich said, my name is Matt Delaney. I'm the Government Relations Manager at the National Bleeding Disorders Foundation. I work with chapters across the country, particularly the eastern part of the country, including NEHA, and on any sort of state policy, but as well some federal policy impacts and keeping the chapters community members informed as well as helping alongside the advocacy agenda. It's really great to see amongst at least the people who are in the room tonight, a lot of familiar faces. It's really also great to see a lot of new faces too. Looking forward to talking about kind of a mix of things. Since I gave this presentation at Fall Fest, a lot has obviously changed. There is still a lot of things up in the air, but I wanted to be able to provide one, what has kind of happened this year and what is kind of going to happen going into 2026, as well as some relevant insurance related and insurance and access related um, uh, matters that we in the public policy and access department are looking to fight, but also educate members of the community on. So with that, we're going to talk a little bit about what has happened this year and until we go into kind of what to look out for and what is moving forward. So many of you know that this is the first full year of the second Trump term. And with the second Trump term, the Republicans have what's called a trifecta, meaning that the Republican president holds power in the White House, as well as the Republican Party holds majorities in both the House as well as the Senate. So, over the last year, the Republican Party as a whole, led by President Trump, has been able to go through a large scale movement of their agenda. That includes some healthcare items as well. We've seen more executive orders than we have in any year in U.S. history, 210 in 2025 alone. I'm sure that number is even slightly higher now, but a flurry of executive orders, some of which pertaining to healthcare. Um, we also saw the passage of H.R. 1, as well as reductions in force at federal agencies, including federal agencies that I'll get into in a few minutes, being the Centers for Disease Control, as well as the National Institutes of Health, as well as the FDA. So, what kind of policies happened this year, and what kind of policies are taking effect over the next couple of years? I'm going to talk a little bit more about H.R. 1, which is, you also may know as the One Big Beautiful Bill Act that passed this summer across party lines. This reconciliation bill made a lot of large scale changes to many facets of the government, but trying to find cost savings, the legislation largely targets a lot of areas in healthcare, particularly the Affordable Care Act state marketplaces, in which around 10 to 15% of individuals receive their insurance through the ACA marketplaces in their state, as well as Medicaid, which we have seen with H.R. 1 or the One Big Beautiful Bill Act, the largest changes to the Medicaid program since it was launched almost 70 years ago. And many of these policies that took place as a part of H.R. 1 are kind of going to affect in different times. So there is not that much that is going to affect on January 1, 2026 in just a few weeks from now. But moving forward from that, all the way up into the 2030s, drastic changes to the way that we fund our healthcare system, as well as Medicare and Medicaid, are going to be occurring. And that's where a lot of the advocacy that we are going to have to do as a community will be taking place over the next couple of years. But to talk a little bit more about, I think I have duplicate sides here, about the Medicaid program in particular. So when Congress passed HR 1, they implemented many more mandates for both states that are administering their Medicaid programs, as well as individuals who receive Medicaid, particularly in states that have expanded Medicaid in recent years. So, alongside the Affordable Care Act, which passed over 15 years ago now, states had the option to expand their eligibility populations in Medicaid from 100% of the federal poverty level, so someone on the poverty line or lower, to someone within 138% of the federal poverty line. So, to give you a little bit of what that actually looks like for a number, the current federal poverty line for a single adult in the United States is $15,650 a year in income. For a joint household or a family, it's around $21,150 a year. Now, when we're taking that for 138% of the federal poverty line, what does this mean? For a single adult, that's $21,597 a year in income. And for a family, that would be $29,187 in income. So anywhere below $29,000 a year for a family, an individual will qualify for Medicaid under Medicaid expansion. So the policies that are taking place in Medicaid start on January 2027, and they primarily impact individuals between that federal poverty line and 138% of the federal poverty line. That's what we call the expansion population. So these are what these policies, the individuals within that expansion population, are what these policies in Medicaid are affecting. So what can we expect? Starting in January 2027, states are mandated to have community engagement or work reporting requirements for Medicaid expansion, both applicants as well as current enrollees. That is around what the federal government has since advised is that that would include 80 hours of work, relevant education, as well as volunteering opportunities for individuals who do not have a disability exemption. What do we know about a disability exemption? We are still not sure. The federal government released very limited guidance on what exactly a state can say would be an exemption or a disability exemption. We are still waiting on that from the federal government. So states are really working on a short timeline to be implementing these programs. Individuals in the expansion population can also expect more frequent eligibility reviews. So every 6 months rather than 1 year, they would have to redetermine their eligibility. Mandated cost sharing exists now for the expansion population, also starting in 2027 of $35 per service, similar to a copay that you would pay at a doctor's visit or a copay that you would pay for certain prescription drugs, for example, and many other impacts to Medicaid and the Medicaid population and who qualifies for Medicaid. And that includes many classes of lawfully present immigrants will lose their eligibility for Medicaid and CHIP. So where do we go with all of this, right? And I kind of, before we move forward and do kind of how do we prepare ourselves, what do we expect, and what can we do, kind of we've had to, with all of these changes, kind of reshape what our thinking looks like as a strong or small but mighty policy department within NBDF. That includes state level advocacy through the work with NEHA and state legislation that I'll talk about more in a little bit. And that includes supporting the chapters each step of the way in their advocacy program. It involves education too, because not only can we, advocate against changes, but sometimes, no matter how much we try, some of these things go into effect, such as HR 1, for example. We had individuals in the Capitol every single day, governors, members of Congress, community members around the country sending phone calls, letters to their members of Congress. But sometimes things do go through that may harm the community. So, how do we work and pivot to ensure that people are educated about these changes to keep their access to care? And finally, our federal advocacy. And that's going to include a lot of regulatory advocacy. And again, everything that we do at NBDF in terms of advocacy is step in line with the chapters because all politics is local, all policy is done locally. And we really do have a large grassroots movement in the bleeding disorders community that is not seen in other bleeding disorder spaces. So when we're talking about Medicaid and the changes that come in 2027, 2028, and 2029, what should Medicaid enrollees be doing right now in order to protect their coverage? So reminder that these policy changes are not in effect yet. The Medicaid work requirements, for example, actually many of those points on that slide will take place or are forced to take effect on January 1st, 2027. That said, we need to start, particularly someone who may be on Medicaid or those loved ones that we have who are on Medicaid, we need to start planning as if we are going to be in effect on these this year, right? So, knowing the name of your Medicaid program, which I'll list those in a moment, making sure your contact information is up to date with the state as well as with your Medicaid department. I worked in government, in state government for quite some time. The state bureaucracy does not work well. So you really need to be proactive in ensuring that your address and information is up to date. And that includes checking your mail and responding within the deadlines. Um, we also encourage individuals who are on Medicaid to start taking a look at what their monthly activities look like, whether that be through work, volunteering, school, right? Taking documentation of that. Um, we are going to have a better understanding of what will count and what won't count in terms of maybe education or exemptions within the next couple of months. And that's going to be a point of advocacy as well. But in the meantime, understanding how many hours you are doing in these categories is going to be very important. So knowing the name of your Medicaid programs, right? And in New England, it's luckily pretty easy. Connecticut, Husky Health, Massachusetts, Mass Health. Maine is Maine Care. New Hampshire is New Hampshire Medicaid or Granite State Care. Rhode Island and Vermont are just their names in Medicaid. So it's a little bit easier in New England than some other states, but in a lot of states, their Medicaid program doesn't have the word Medicaid in it, isn't even remotely tied to the state. So it can be very tricky for folks. Another thing that we're going to be looking out for over the next few months is due to a lot of these new mandates that have been given to states that have costs tied to them, such as setting up these eligibility reviews, these new databases for Medicaid recipients, alongside the potential loss of advanced premium tax credits, which I'll get to in a moment. We may see more shrinking within states of their expanded Medicaid programs. So not necessarily not expanding or going back to 100% of the federal poverty line, but for example, Massachusetts and Maine both have programs for young adults, for example, in which their Medicaid eligibility is expanded even further with those incomes. Keeping people insured is cost effective to the state, but at the same time, expanding that population does cost money, and states are going to have hard decisions to make. And that's going to be a point of advocacy that we're going to need all of your help, whether you're on Medicaid or not. Understanding how important coverage is, how important continuity of care is, and bringing that to your legislators is going to be really important because I think some of these expansions could be under threat. So a couple of quick insurance things. What are we kind of seeing brew on top of what Congress is doing? And this is going to be a big focus for NBDF over the next year, which is formulary exclusions. So not only is marketplace insurance, for example, where this is most egregious, getting more expensive, the coverage is also getting worse. So in some commercial plans, but more so in marketplace plans, we have been starting to see plans put out formularies in which little to no bleeding disorders therapies are covered whatsoever. Um, Under current rules, insurers only have to put one product per class. So, for example, Ambetter, which is in Tennessee and a lot of other states, I believe they tend to be more active in the South, doesn't cover any clotting factor concentrates on their formulary. And we believe not only is that to, um, save money on their end, but also discriminate against people with bleeding disorders and high cost conditions in general from purchasing their insurance in the first place. Now, we have been in our payer department been having conversations with United Healthcare and other commercial insurers and actually moving forward a little bit on this issue on the commercial side. However, on the marketplace side of things, it can be very, very difficult. There is a pathway. If you do experience this and you have no other options, please let us know. Rich can connect you with me, and I can connect you with our insurance and payer access department. This is a key area of advocacy for us with the patient groups, and we can help you, go through an exceptions or appeals process alongside your HTC if you do find this occurring. And that could include you might want to explore patient assistance programs, at least as a bridge in the meantime, if your clotting factor is not covered. But ultimately, if you find one of these plans in which no clotting factor is covered and you can't find any other care, let us know because we can try to work through that the best we can. So going to the enhanced premium tax credits, which it seems like recent history, but it was quite a few weeks ago. We had the largest government shutdown or the longest government shutdown in history. It lasted well over a month. I believe it was 53 days. And this was the topic in which it was shut down over. So the enhanced premium tax credits are tax credits that started during the COVID era. There were previously smaller tax credits that existed since the passage of the Affordable Care Act in order to keep premiums low for individuals to access marketplace insurance. During COVID, Congress expanded those and enhanced them so that individuals, instead of, perhaps low income individuals, or it was individuals making underneath, I believe it was 85 to $90,000 a year, would receive tax credits. Congress enhanced those in order to extend that to individuals making much more than that, $200,000 a year, for example. Most people now are eligible for some form of an enhanced premium tax credit. We have been talking with Congress over the last 2 years now about what the plan is to either draw down the tax credits or keep the tax credits permanent. It was a talking point at Washington Days this year as they were set to sunset on December 31st of this year. We have been told that that would be addressed in HR 1. That did not happen. We were told it would be addressed just following HR 1. It did not happen. Congress has kicked the can down the road. And particularly during the shutdown, there is particularly no end in sight. There is now about 19 days for Congress to pass these enhanced premium tax credits. We have seen some bills float around even just today that have failed in both the Senate as well as the House. Speaker Mike Johnson, as well as Senator Bill Cassidy, both Republicans in the Senate and the House, have floated a potential healthcare plan. But needless to say, we have 19 days until these tax credits expire. There is a possibility that we could start in a special enrollment period. If they do not extend them, Congress would have until January 15th potentially. But either way, there is a small but significant chance these could get extended, but also there is a significant chance these could not get extended either. So what would that mean? Premiums would increase on average around 114%. And we estimate that around 4.2 million people will drop their coverage as a result of these enhanced premium tax credits expiring. We're particularly worried about this because as individuals who are healthier, right, don't have as much cost alongside their health insurance, if they see $2,500 a month premiums, they're going to go without insurance. Or individuals may decide to stop working and maybe go on Medicaid as a result, at least for the time being. Many people will lose their health insurance with unaffordable premiums. And the worry is that as more and more people like us in the bleeding disorders community with chronic conditions are purchasing this very expensive insurance, not all, not independently of having us spend a lot of money on that insurance, more so than ever before. Individuals who were paying into it who didn't have as high claims are leaving the market. And that just means that premiums go up and up and up and up. And we do call it a death spiral because we truly believe that without these tax credits, at least extended for the next year, that the Affordable Care Act at that point is very slim. So again, what can we look at for impacts in terms of premium increases if these tax credits do not expire? This is for a family of four making $64,000 a year. In Connecticut, can expect a 541% increase. In Massachusetts, 510% increase. Maine, 187% increase. New Hampshire, 228% increase. Rhode Island, 488% increase, and Vermont can expect a 182% increase. It is simply unaffordable. I have a sister who is now 26 and is self-employed, who looked at marketplace plans and she cannot afford them. So she is thinking about the decision of going on a Medicaid program in New York State and making less money instead of purchasing health insurance and increasing her income. And unfortunately, many people may be left in this position if Congress does not extend these tax credits. So for those of you on the webinar, but also for those of you viewing, we have a series of QR codes, and I can share the links with Rich afterwards if you don't want to, anyone on the call doesn't want to go through the QR code business. I can share them with Rich afterwards. But we have a action alert software. We're going to talk about many other ways that you can get involved in advocacy later on in the presentation. But if you want to do anything to do it quickly, utilize our Legislative Action Center. That's an area where you can sign up, you can put in your address, and you can send customized letters. We give you a prompt, but you can customize it however you'd like. Click one button, and it goes to all of your senators, representatives, preloaded. So I can share that with Rich after the presentation to go alongside the recording of this presentation, but also we'll have a series of QR codes on the screen, and we really encourage you to send a message to your lawmaker about the next couple of issues we'll be talking about as well. So summing up we are currently kind of at the end of open enrollment at this point, but anyone who is still going through their open enrollment, anticipate those higher premiums. Make sure that your financial information is up to date and make an active choice. But we also have another QR code to our insurance toolkit. If you look up NBDF Insurance Toolkit on Google, it'll be right there. This goes through all of the different types of insurance, common terms. We have worksheets even to kind of compare plans. So we're really excited to kind of release it 1 or 2 years ago and keep it updated. We do not, unlike previous years, have information about the premium tax credits. We thought we would have it by now, but all of those portions have been removed. But otherwise, everything is up to date. We've gotten feedback that it's helpful, and we hope it's helpful to you too. So feel free to utilize that during the final days of open enrollment. Moving on to federal bleeding disorders programs and reductions in force. So we experienced HR1 over the summer, but kind of the first thing to occur in this difficult year was a reduction in force at nearly all of the federal agencies, but that including the Centers for Disease Control and Prevention, the Department of Health and Human Services, um, portions of the National Institutes of Health, and those included critical bleeding disorders programs, particularly the CDC Division of Blood Disorders and Public Health Genomics. The CDC Division of Blood Disorders and Public Health Genomics does a lot of research collaboratively with NBDF, but also independent research regarding inhibitor testing and other things. We have been able to work with organizations like ASH, the American Society of Hematology, to make sure a lot of the data that they wiped as a result of those reductions in force has been kept. We have confirmed that the samples used for inhibitor testing are still there. However, particularly as someone who communicated with the CDC and the FDA as a part of our work here at NBDF, the difference is striking. There were previously over 2 dozen employees at the CDC Division of Blood Disorders and Public Health Genomics. There's now 2 staff for the entire department. And um, we have gone through the previous years with this staffing and fighting for funding, and we were able to do that this year. We received full funding for HRSA hemophilia program for HTCs, even for the Division of Blood Disorders and Public Health Genomics. We've received funding, but there aren't any staff, and the level of institutional knowledge that has decreased as a result of that, as well as the organizational chaos within the agency, has been really difficult to manage. So while we were pleased to of course receive level funding for these programs, at the same time these programs have been utterly decimated when it comes to staff as well as some of their activities. There are 2 programs particularly relevant to the bleeding disorders community or advisory committees, both within one is under FDA, the other is under HHS. The one under FDA, the Blood Products Advisory Committee, is still functioning. However, the Advisory Committee on Blood and Tissue Safety and Availability, or ACBTSA, is under the Department of Health and Human Services. And that advisory committee, although the charter has them until next year, has been terminated and the web page doesn't exist anymore. And we had a member of our community, Michelle Kim, serving on that advisory committee to talk about issues of blood safety, transfusion safety, and that no longer exists. So we are working with members of Congress. We encourage you to reach out to your members of Congress as well to get more eyes on this issue. I know we joined a letter with all the bleeding disorders organizations on this issue to send to Congress recently. So we are hoping that in the new year we can be more collaborative following reconciliation and all of the things done this year to really work on these bleeding disorders programs that are vital to our community's safety. I do want to note though, before I go on to kind of what are we doing moving forward? Although these advisory committees have been terminated, I do want to be clear that FDA inspections still occur at clotting factor manufacturing facilities. There is still testing being done. We do get questions constantly about, particularly me as a patient as well, about the safety of someone's product. And I would say that there have been, many strides made over the past, number of decades, but also we need to remain vigilant and also keep that fight in us in making sure that these advisory committees come back because once they are gone, they are much more difficult to reinstate. And I think we need to remind them of what can happen when the federal government takes their eyes off the ball, so to speak. So on these issues, we need your help. So regarding HR1, we are going to be working in all of the states, including with NEHA. There will be a lot of states considering changes to Medicaid, further cuts to Medicaid, as well as maybe some states to increase protections in light of the changes at the federal level. We are really looking forward to seeing some perhaps medical debt bills be added into states this year, and we will certainly need the patient voice and patient stories in order to do those. We are still working on copay accumulator and maximizer programs. We have a bill currently in Massachusetts. We are also hoping for another effort in New Hampshire this year, and the rest of, and we will also see about Rhode Island as well. And of course, we are really working through the end of the year on those enhanced premium tax credits, as well as in the new year on hopefully strengthening some regulations that have been cut over the past 1 to 2 years. So the Help Lower Patient Copays Act, also known as Help Copays Act, I have some very exciting news. So this is our federal component to state-based copay accumulator regulations. So on the state level, which I'll get to in a minute or two as we go into what's happening in New England, um, those bills cover state regulated plans, being the state employee plan, for example, the Affordable Care Act marketplace plans, um, but most other plans, including almost all employer plans, are regulated on the federal level. So in order for the vast majority of plans to have copay accumulator protections, we need an act of Congress. So that's exactly where the Help Copays Act came from. This is a ban on copay accumulators on the federal level. We have had success in Congress in the past of obtaining hundreds of co-sponsors. Those co-sponsors have been really helpful in aiding our ability on the federal front too to have regulatory advocacy with the Center for Medicaid Services, Department of Treasury, for example, who create regulations on these issues. But an active legislation is still our best bet. So we, with the new Congress, have new bills both in the House or both in the Senate as well as the House. Our Senate bill, Senate Bill 864, which I'll have on the next slide, is sponsored by Senator Roger Marshall of Kansas and Senator Tim Kaine of Virginia as our Democrat. And in the House, which we just got introduced late last week, early this week, is introduced by Representative Tom Keene, a Republican from New Jersey, and Representative Nanette Berrigan of California. So we will be doing a lot of outreach over the next coming weeks for individuals to reach out to their members of Congress on this. The Quorum Action Alert is a good way to do this, but we will also provide more to the chapters. So stay tuned to reach out to your member of Congress, whether they've been a co-sponsor before or a co-sponsor or not a co-sponsor yet. We are going to need their help. Doesn't matter if they're Democrat or Republican. This is a bill that is as bipartisan as it gets. So we really want to get the hit the ground running, particularly in the House of Representatives. It is so new that it still does not have a House of Representatives bill website yet, but it should over the next couple of days. And I encourage you to share it amongst your networks as well. And before we get into some slides about New England and then questions, I did just want to touch on something new that NBDF did this year and are looking to continue into next year. This year, we had a group of women and girls throughout the bleeding disorders community come to Washington, D.C. on April 17th, which was World Hemophilia Day, to discuss issues particularly related to women and girls with bleeding disorders, both menstrual hygiene and care access, early diagnosis and pathways to early diagnosis, as well as uh, research for women and girls with bleeding disorders as well. So this was an issue we have been looking to introduce and have been working with some HTCs to identify gaps in care and also see about potential legislative efforts or regulatory efforts. Ultimately, with HR1, the reductions in force and all of the things this year, we have had much more on our plates, but this is something that we are definitely bringing into next year as well, and certainly something we're looking forward to doing next April as well in Washington, D.C. All right, so what about New England? And before I get into this, I did say earlier that all politics is local and all policy is local, and that is really true because all of these impacts that I just talked about, there are so many. There are so many issues that we can talk about more in depth, but all of them that we talked about tonight have been mandated by Congress for the states to implement. So Congress passed many of these new provisions, many of these new mandates, and it is now up to the states to implement them in the way that makes sense for their state. So, as we talk about kind of ways to get involved, remember that, advocacy is not just going to Washington days or writing your member of the Senate or the House. It really is local. And I encourage you also, to get more involved in state efforts if you aren't already. So I talked a little bit earlier about the Help Copays Act, as well as the copay accumulator landscape generally. So remember, we kind of have a two-pronged strategy, one being on the congressional level, but also on the state level, not only to protect individuals with who are on marketplace plans or state employee health plans, but also particularly for a member of Congress, if their state legislature passes a bill in their state, they will have more pressure to support it in the House of Representatives or the Senate as well. So we've been working over the past several years now on legislation across the United States for copay accumulator adjuster bans for bleeding disorders patients and all patients with chronic conditions. So we have had a lot of success over the past few years. We This year in particular, we had four more states pass legislation, that being North Dakota, Iowa, Indiana, um, as well as Maryland. And we are currently in the final days, seeing if New Jersey will be the 26th state to do so. We still have legislation in Massachusetts, and currently for New England, you'll see Maine has a copay accumulator ban. We are still working on New Hampshire. Massachusetts, we have a bill in. Connecticut is already passed copay accumulator adjuster reform. And Rhode Island, we have gotten so close for a number of years with our friends at the American Cancer Society. But ultimately, the speaker has shot it down the last two sessions. So we are still trying in those states, but across the country, we have several bills that are still in session. You'll see those states in blue. The state in yellow, Iowa, again, they were the 24th state to pass reforms. The reason why I put that in there is, again, state impacts creating federal impacts. Our PBM reform bill in Iowa, in which we put copay accumulator language into, was sued in federal court. And the entire bill, minus the language that banned copay accumulators, was struck by a federal district court. So not only does it show that these laws must be enforced and must be enforced on the state level, and we're well within our rights to do so on the state level, this also can create precedent in the federal courts moving forward. We have been part of lawsuits in the past with the HIV Hepatitis Policy Institute in which we won in 2023 and then won on appeal that would effectively ban copay accumulators, at least temporarily. But neither Biden nor Trump administration has enforced that court ruling. So the court rulings matter. That's why we wanted to put it in yellow. And finally, in Minnesota and Nevada, those are two additional states. As a result of that 2023 lawsuit, their departments of insurance have been enforcing through regulation bans on copay accumulators in that state. So in total, 27 states plus DC and Puerto Rico have now banned copay accumulators. We started this effort legislatively around 2018, 2019. So now over a majority of the country have banned copay accumulators, and it's time for Congress to act now too. So state issues going into 2026. So what are we going to kind of be looking at? And New England and NEHA, it's always a little bit tough because we have six states all in one little region. But for copay accumulator ban legislation, we still have legislation in Massachusetts. We are, I'm optimistic we can hopefully get something introduced in New Hampshire, Rhode Island, but we'll certainly be pursuing that over the next year. There are additional tactics by insurers, such as copay maximizers, as well as alternative funding programs, which I don't have lots of time to get into today, but all schemes by insurers as well as pharmacy benefit managers to extract copay assistance money from the patient's pocket and not counting it towards their deductible or out-of-pocket maximum. We will see these bills kind of pop up throughout the year. Myself and Rich talk all the time about different bills that are being introduced each and every day come January, February, and March. So we are kind of expecting, some of these to pop up, either bills that would allow some of these insurer tactics that we need to fight against, or maybe some proactive bills that we're able to pursue as well. Medicaid work requirements and additional Medicaid cuts. So we have already seen over the past couple of days some action in New England in this regard. So in New Hampshire, we have Senate Bill 134. This would require the state of New Hampshire to send a waiver to the federal government to essentially allow them to enact early work requirements in the state of New Hampshire, being 100 hours per month. And it would overall tighten eligibility requirements for the Medicaid program. Now, the current bill is set to die at the end of the year, but we are looking that sometime in January, probably early January, it will get reintroduced as amended and it will go through that process. So we are going to need people in New Hampshire's help, and I see Scott and some other folks on here, and we'll be reaching out. We will need your help in advocating for why Medicaid is so important and how it keeps individuals with chronic conditions like bleeding disorders, like ours, healthy, and how work requirements, particularly the reporting requirements and the bureaucracy that goes along with them, are particularly harmful to patients. So we will see that certainly in New Hampshire, but perhaps in other states as well, as we are seeing currently in many states throughout the country outside New England who are looking to implement work requirements even sooner. We are also really interested in medical debt legislation. There's lots of different flavors of this. This is legislation that reduces overall the impact of medical debt anywhere financially. So it could be your credit score, any other financial activities or consequences, or can impact daily living, such as debt collectors going after you, right? Particularly with the unaffordability of healthcare at this point, the impacts to Medicaid, the increased premiums, medical debt is becoming more and more common, not only in the bleeding disorders community, but everywhere. But can we, fight for legislation that would lessen that impact? One of the evergreen things is proclamations, resolutions, and local advocacy. Some of the state leads amongst NEHA who are here tonight, as well as any of you, proclamations with your governor for Bleeding Disorders Awareness Month, resolutions in the legislature. I think we have all of the states covered in the legislature and the governor's offices this year, but if you do have a connection with any legislator or the governor's office, reach out to Rich and the team at NEHA. And additionally, if you are interested in doing a Bleeding Disorders Awareness Month proclamation or resolution in your hometown or in your home city, we can help you do that. We write the language, we can give it to you. And it really is important to have those local events there in your town or city. It really does make a difference. It may seem something that's easy, and typically it is, which is a great thing. But it is really impactful on that local level as well as the state level as well. And it does go a long way. So, certainly an opportunity for folks always to get involved. Finally, one of the things that may look a little bit different this year, and this is going into my next slide here, is that a lot of the things that we may be dealing with this year, of course, may be occurring in the legislature, but it also may be occurring, I put it on the other slide as backroom, right? Regulations, changes to the Medicaid program, how a Medicaid program is funded, the formularies to a Medicaid program, lots of regulatory advocacy that may not be done in the particular way that, people in legislative advocacy may be used to. Oftentimes, this may include things like comment periods. This may include filing complaints with a Department of Insurance or another state agency. Advocacy in these ways, particularly as it comes to maybe changes to Medicaid or other things, may look in a different form this year than it is last year. But us, NBDF, as well as NEHA, will always provide the tools that you need in order to be successful at advocacy. We just require your help. And we always appreciate when members of the community are willing to advocate for their community and for NEHA and their state. But if you are ever concerned about, can I do this? The answer is yes, you can, and we are here to help you. So, kind of overall for NBDF, we, are looking at really protecting Medicaid across 50 states, and 50 different states comes with 50 different Medicaid programs. So we have the opportunity to shape at least somewhat the future of Medicaid programs eligibility requirements in that state. We want to make sure that we are protecting HTCs. There are state impacts that can impact HTCs, such as state 340B bills or something, that may impact an HTC in the comprehensive care model. And we always want to make sure we're protecting that access to HTCs, no matter if you're on private insurance or if you're on Medicaid. So Medicaid eligibility and HTCs access is going to be really important. And most of all, as we go through the legislative sessions in 2026, and I put them up there, states have hard decisions, and they have very much have strained budgets this year. Many states, I remember working in the New York State legislature, in which we do the budget every year, and we would get our projections around the fall, winter time, and that has a massive impact on how the budget in those states are crafted and how they're created. So we are going to be looking very much in early January at each state in New England's respective governor's budget for funding to Medicaid, what their plans for Medicaid may be. We'll be watching their legislature for what we can expect with any changes to those programs as well. And we'll be watching the regulators. And all of those will have many opportunities for advocacy moving forward. But again, most of the sessions throughout New England run generally from January or February through May or June. So throughout the next year, just keep your ears out. We will certainly be reaching out to you. So stay tuned for NEHA's advocacy e-newsletters, obviously. If you want to get involved, we will have many calls to action moving forward. And even just when you get an email from Rich about something happening in your state, that help is greatly appreciated, not only from him, but through us at NBDF and the broader patient community who we are all working with. Because we cannot do this at NBDF alone. We cannot do this as a bleeding disorders community alone. We have to do this with the entire health and chronic disease community in order to have an impact. So we're going to need you because we're going to need all of us in order to fight some of these impacts and hopefully create some protections as well. So with that, I'm happy to take any questions, but otherwise, thank you very much for listening to my presentation.
Thank you so much, Matt, for the awesome presentation here. There are a couple of questions in the chat.
Okay.
So Craig asked, does the formula affect Medicaid and Medicare?
So, okay, good question. So, the formularies for Medicaid and Medicare are going to be different. So the Medicaid formularies are going to be different by state. Medicare is purely federal. So all of our drugs, bleeding disorders therapies, are going to be in Part B of Medicare versus Part D of Medicare. Ultimately, that tends to protect us from a lot of the out-of-pocket cost stuff, as well as insurer tactics, particularly if you're able to get away from Medicare Advantage when possible, or Medicare Advantage when possible. The formularies otherwise for Medicaid. So in Medicaid, Medicaid departments need to list every FDA approved therapy and provide a pathway to access for every FDA approved therapy. But states can make that as difficult as they want. So ultimately, with Medicaid, they tend to be a little bit better with the guidelines, at least of most bleeding disorders therapies. But when it comes to the formulary issue on the Affordable Care Act marketplace plans, it is more or less the Wild West out there. So that's why we are seeing both in the commercial plans as well as the Affordable Care Act marketplace plans, formularies that are far more restrictive than both Medicaid and Medicare. I see the second one, Rich. If you're on a marketplace plan and received an amount increase, can it go up after they sent you X price or is that set? So this is part of I can answer part of this question. This is part of the confusing mess that Congress has gotten us into, frankly. Um, if Congress came to any sort of deal or any sort of answer over the last month, we could have been able to avoid this. At this point, as any sort of vote, if any vote, would occur either next week or in early January. Um, Congress, if they extended the tax credits, would have to essentially create another special enrollment period for marketplace coverage or figure out a mechanism. And this is the part that I don't know as much because we just don't know how it's going to work yet. But create a mechanism for you to say if they extend the tax credits, take advantage of those tax credits in the next cycle. So I don't have an answer any clearer than Congress, unfortunately. But that being said, Congress will have either some sort of tax reconciliation process that you'll be able to go through, or another special enrollment period. If they extend the tax credits, you will get that money in some way, shape, or form.
Gotcha. Yeah, that's been a question that has come up that we've seen two situations. One where community members are not on any subsidies, and I think that price probably will stay the same because they're not
Yeah,
on subsidies. So whatever they got, because most of the time you're getting billed in December for January, so the
yeah.
money's going to come out. If you're on the tax subsidies, a price came out, but as you said, there's so many variables around what that will be, if the tax subsidies are going to be extended or if they're not, and if they're going to go up by those astronomical percentages that you showed.
Yeah. Yeah. And again, because these, the enhanced tax credits are what we, are at risk, the previous premium tax credits, which were a sliding scale based on it was I forget what specific metric, but it was more or less between like 100 and 150% of the poverty line or something like that. Essentially right after the Medicaid expansion population. um, those individuals wouldn't see much of an impact at all because those tax credits are permanent. However, when they enhanced them, more people got subsidies and everyone got a lot more of them. So individuals, particularly as you go higher income, frankly, are going to see higher costs generally. I see Scott's question. Previously, an employed person could sign up for an ACA plan if the group insurance from the employer doesn't cover factor. Is it correct that a person cannot now sign up for ACA if their employer offers any type of health insurance? I don't know the answer to that question, Scott, but I can find out. I don't know if that changed or not. Any other questions?
Well, Matt, you're right on time here. 7:59. It was a lot to cover over an hour. We really appreciate you taking time after being at Fall Fest and doing this presentation again live and then as a recording. It's going to be a really essential record piece for the community to listen to, and it'll be interesting. Maybe in a month from now, we can watch this again and see where we are. Hopefully, there will be some good updates, but we will see here. But
Happy to do another one, so let me know.
but thank you, Matt. We appreciate all of your expertise, time, talents, and yeah, a dog and a little kid playing behind me right here. Uh, but wishing you all a very, very happy and healthy holiday season, and we look forward to reconnecting in the new year here. Thank you, Matt. Have a great night, everyone.
Thank you. Happy holidays, everyone.